Hi, thank you. Thank you for the panel. I did miss part of it, but I'm inspired because part of the Gates Foundation's commitment to the London Declaration is to try and help create networks amongst those of us that are trying to work together to achieve the goals, the NTD goals that WHO set. And within that regard, one of the things that we've put together is this group that is an NTD donors group, so that we can, anybody who's contributing to this space, we can first off know what people are doing. I'm just thinking about the diversity of opportunities that you guys have put before us, and it's like, I would never know that there would be potential legal assistance for a small NGO that might approach me in Nigeria or Botswana, and those things happen. And so part of it is just sharing knowledge about what each other are doing so that we can direct people to those resources. And the other thing is looking at where we can bring our resources together to do more. So if you're interested in being part of this, there's no obligation. You just, we try to communicate quarterly. We try to meet at least once a year face to face. And we share the notes from any of our conversations, and so be really, really happy to expand that group because it's very, very incomplete at this point, and I just see so many synergies that could come out of this, out of knowing the amount of resources and goodwill that's available in this room.
Thank you. That's an excellent opportunity for many of us, I think, to get more involved. Yes.
Just a quick question about the prophylactic. Do you have a prophylactic, or are you developing one?
There has been several studies on prophylactic regimen, and one which has been demonstrated as preventing 50 to 60% is a single dose rifampicin to contact of patients. It's during the two years following the rifampicin tablet. No, one dose, but one dose for 2 years. There is lots of discussion around this because TB people are afraid that it creates TB resistance for TB.
Any other observations, questions? Yeah.
Hello, Edith. I work for Lepra. We were established in 1924 as the first leprosy prevention charity in the world, I think. We're still working away. There's still no prevention, but I was very encouraged to hear what you were saying earlier, and I think that certainly our two organizations have very common goals. I think if it's worth saying, we've kind of given up on the idea of trying to eradicate because it almost seems like it's too difficult. So we've dropped that word from our vision or our mission, but we certainly want to remove the stigma from people having leprosy. We want to work on early detection to try and prevent the awful disabilities that can develop as the disease advances. And so I think, we're doing very similar things to you, so I think it would be very, very useful for us to have a chat in the future. And I think also with, is it Sally, this lady here? Sarah, sorry. As well. It's certainly been interesting for me today to hear people talking about leprosy, because so many people I talk to are just horrified that leprosy even still exists. So it's really good for me to know that it is still on certain people's radar, and that by working together, I'm sure we could achieve a lot more. Thank you.
Any last question or observation? No, in that case, I say thank you again then to all our panelists, present and absent, and I'll hand back to Marianne.